It's fair to say that most anatomy education is designed at teaching human intelligence. But what if we wanted to teach an artificial intelligence human anatomy? Such a program would have many uses in medical education, including in the form of a conversation agent, otherwise known as a chatbot, which could facilitate student learning through individual dialogue. How might we train such a program? In this article, we review the three main approaches to designing an artificial intelligence program and demonstrate the learning facilitation that can be undertaken by such a program we've developed.
The concept of a dialogue system isn't particularly new. In fact, it can be traced back to 1960s with ELIZA. But with recent advances in technologies and how users are getting more familiar with such chat interface, this is the opportune time for us to develop an AI support system for our students to utilize in medical education. The first approach to such chatbots is the fully pre-programmed, sometimes known as rule-based or decision tree chatbot. This offers a number of predefined options for students to select, and each option will give a different response. The creation of such chatbots has been made easier by programs such as Google Dialogflow and Amazon Lex. A rule-based chatbot is often limited to finite conversations. The second approach is inspired by prototyping method, Wizard of Oz, where humans pretend to be computers in answering user questions. In a human-machine hybrid, the chatbot is able to recognize that it cannot answer a question and therefore pass control over to the human operator to answer the questions. This hybrid approach is observed in e-commerce quite often. The human team overseeing the chatbot can therefore slowly expand the repertoire of questions, leading to an increasingly capable chatbot over time. This is something we have undertaken in the past. It has added benefits because it requires a minimum amount of programming to give a highly flexible chatbot. The hybrid bots are an excellent way for you to explore and have initial developments. Also, you can pilot test it with your students.
The previous approaches have the appearance of intelligent behavior. However, to some they may not be considered true artificial intelligence. Therefore, the third approach uses real machine learning techniques to train an algorithm which has considerably more flexibility through predictive modeling.
In this method, the model is pre-trained with millions of texts and paragraphs, and that's how we can generate accurate predictions to responses that are given by the students. Generic algorithms have been developed as open source resources, and examples include Google's BERT and ExcelNet. They must be trained for the specific dataset which one wishes to ask, and this could be anything from human anatomy to clinical communication or applied pharmacology. This approach is more technically demanding, requires familiarity with machine learning techniques, and careful selection and evaluation of the training data used to train the algorithm. The advantages are that it achieves more advanced natural language processing, can tap into a much wider repository of knowledge, and therefore enable users to jump outside of a predefined conversational journey.
And we'd like to share our experience of this third method by describing our study where we developed a full machine learning chatbot for anatomy education using natural language processing, and we picked some specific topics of musculoskeletal anatomy, that is to say the brachial plexus and antecubital fossa. We recruited first and second year medical students at our institution and gave them 45-minute sessions with the bot. We adopted a mixed methods study design with pre-post surveys on self-reported confidence in anatomy using a paired t-test in SPSS and a qualitative thematic analysis of the questions the students asked by entering the student chatbot dialogues into qualitative analysis software in Vivo 12. We had a total of 33 users who generated over 2,600 student chatbot correspondences. They asked for hints on 70 occasions and gave us 43 self-generated questions. In terms of self-reported confidence, there was a modest increase in students reporting in the post-intervention survey, a mean of about 1.2 out of 5 increase, and this was noted to be significant by our t-test. In terms of the student experience, they felt that it improved their anatomical knowledge, and importantly, they felt more comfortable making mistakes in front of the bot than teachers, and indeed asking them questions too. They enjoyed the experience and wanted to use it again. From the technical perspective, they found it easy to use and the questions understandable, but they found that the bot was moderately able to understand all of their questions. In our thematic analysis, there were four themes identified of the questions students asked the chatbots. These were anatomical facts, anatomical spatial relationships, clinical relevance, and the learning approach. In Theme 1, Anatomical Facts, the type of questions the students frequently asked were, for example, simple factual information, such as the origin of certain muscles. However, they'd also ask for more complex information, such as spatial relationships, for example, the boundaries of certain fossas and the roots of certain nerves. They also asked clinical significance and clinical relevance questions, such as the consequences of damage, or why clinical procedures were undertaken in this area. Finally, beyond direct questions of anatomy, the students also asked the chatbot about learning approaches, such as the best way to study anatomy and any mnemonics. So we found that generally the students' self-perceived confidence increased and that there was a positive user experience to this true machine learning chatbot. They asked a range of questions from fairly simple factual information ranging towards more complex clinical questions, as well as these metacognitive questions about how can I study this subject. We felt the freedom to make mistakes in front of a bot compared to human teachers was an interesting and important finding. But we also note the technical challenge that the chatbot was not able to understand all of the questions from the perspective of the students. In conclusion, we've described three iterations of chatbots: the rule-based, the hybrid, and the machine learning chatbot, and these increase in complexity in terms of their development, as well as their potential. We've given you an example study where we've developed a chatbot for anatomy education, and we hope its use case and the potential difficulties are illustrative for those of you considering chatbot for medical education.